Hello everyone, this is Bladder Cancer Awareness Month. What do I want you all to know about bladder cancer? Bladder cancer can be caused by excessive smoking. So please quit the stick if you are a smoker. It's going to go a long way in helping prevent bladder cancer. Apart from this, you have to know that the commonest symptom of bladder cancer is blood in urine. So a urologist is going to get some testing done once you have blood in urine to diagnose bladder cancer. Bladder cancer is completely curable if detected early. So once a bladder cancer is diagnosed, we resect the bladder cancer with the help of camera called cystoscope, and we do a procedure called TURBT to remove the bladder tumor. So once the bladder tumor is removed, depending on the depth of invasion and the grade of the bladder tumor, the treatment varies from just medications which are instilled into the bladder to even bladder removal, complete bladder removal, depending on the fact that it has crossed the muscle barrier in the urinary bladder. So bladder cancer is completely curable if detected early, and there are a lot of advancements coming up in bladder cancer, and quitting smoking will go a long way in helping prevent bladder cancer. Recently, I had a chance to perform a robotic surgery for bladder cancer on a 50-year-old male from a nearby state. So he had been neglecting the symptom of blood in urine for the last 2 to 3 years. Somebody told him that this could be just infection, increase your water intake and you'll be alright. So finally, when he came to me, he was diagnosed with an advanced bladder cancer. So urinary bladder cancer, when it goes beyond the muscle layer of the bladder, needs to be treated with robotic or open surgery of the bladder, wherein we remove the bladder and create an alternative path for the urine to come out using a piece of intestine known as ileal conduit. So now he is undergoing chemotherapy following the bladder cancer surgery, and he is doing well. All these major surgeries and complex treatments could have been avoided if he had presented very early on, maybe 2 years back, when the bladder tumor might not have breached the muscle layer of the urinary bladder. And we could have just done with a TURBT or a endoscopic removal of the bladder tumor and given some medications for chance of recurrence. So do not neglect blood and urine. It is never normal, and sometimes we can detect life-threatening conditions with this symptom. Thank you.